Good afternoon, everyone. Thanks for joining us. It's 2 o'clock and time to get started. Our featured speakers for today's briefing are Milwaukee Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services at the Milwaukee County Office of Emergency Management, and Darren Rausch, Health Officer and Director of the Greenfield Health Department. Mayor Barrett, we'll start with you.
Thank you very much, Sydney. And I want to start out with our testing numbers. As you all know, yesterday was Veterans Day. So two of our sites, our South Side site and our Northwest Side site, were closed. Our Miller Park site was open. And as it has been really since it began, it was busting at the seams. We had 2,498 people who were tested yesterday at Miller Park. Again, the capacity that we had pegged at around 2,000. So since it's opened, it's been running above capacity. And I want to acknowledge and thank all the people who are working at that site. They really have been going above and beyond the call of duty. But that tells you how strong the demand is. And unfortunately, when we hear from Dr. Weston, we're going to hear that the numbers, unfortunately, are reflective of the surging pandemic here in the city of Milwaukee and throughout the state of Wisconsin. But for the week, we're over 10,000 people that have been tested at our city sites. We will continue to test at those sites because we think it's very, very important. Again, it's the Northwest Side site on Mill Road, 76 and Mill Road, the South Side site on South 23rd Street and Miller Park. So we've got two in neighborhoods. We've got one much more centrally located. So please take advantage of those. We continue to work on expanding the hours, and we are hoping to have more announcements to make next week about expanded hours. But it is not open this Saturday. Miller Park is not open this Saturday, nor are the other sites. But we, again, are working to see what we can do to expand the hours of those sites later in the month of November. I'd like to turn now to the Restart Grant, and we have had some good news there. As you may recall, the Restart Grant is the program that we created using the Federal CARES Act dollars to help small businesses. Essentially businesses with 20 or fewer employers that have annual revenues of less than $2 million. We went through the first phase of this and had good success, but we've had even more success in the second round of funding. And we expect to distribute up to $10 million in this second round. The Restart, as I said, uses federal relief funds to assist established Milwaukee businesses as they recover from COVID-19 related setbacks. The Restart program closed the application process in early October, so we are currently making the decisions right now. And as of today, 728 grant applications have been approved for small businesses. A total of more than $9 million has been committed to these approved businesses. And what's interesting is of the approved Restart applications, about 50% of them are businesses are minority owned, and more than 45% are women owned. So we're getting a lot of diversity, which I think reflects our community in a very accurate way. The Department of City Development is still reviewing 59 applications, which if approved, will bring the total distributions to nearly $10 million. The $1.7 million has already been sent to the grant recipients. The others should be getting their checks shortly. What's also, I think, something that's good to talk about is that a wide range of businesses applied for the grants in categories such as retail, hospitality, and service businesses. In the latest round of the Restart program, several new categories of businesses were added, including home-based businesses, food trucks, licensed daycare, and state licensed group homes. So again, our goal is to get this money into the community, and we think we've been pretty successful. This is flu season, so I'm going to bounce back to the flu issue because here we are fighting this pandemic at the same time that we are gearing up for our annual flu season. And here we've got some relatively positive news to report as well. The Milwaukee Health Department's goal this year, which is very much a stretch from prior years, was to administer 3,000 flu vaccines this season. With our drive-through vaccine clinics, I am pleased to report we're now on track to reach that goal by Thanksgiving. In particular, the Northwest Side Health Center and the South Side Health Center have been really, really active in helping people both with the pandemic swabs as well as providing them with the vaccine for the flu. So we're currently trying to secure even more vaccine to be able to extend the service. But already we've had over 2,168 flu vaccines have been given, 836 of those on the Northwest side, 1,051 have been given on the South side, And we have a partnership, which I'm very, very pleased to report, with Children's of Wisconsin and Milwaukee Public Schools. And we've given 281 flu vaccines out through that as well. As I said, the goal is to administer 3,000 flu vaccines, and we think we're going to easily reach that goal and hopefully go well beyond that, particularly if we can secure some extra vaccines. So I really want to give another shout out. Our Milwaukee Health Department has been just amazing through administering flu vaccinations, managing the COVID-19 testing and tracing, and educating the public on how to keep themselves and our community safe. They have been working tirelessly since this pandemic began. And I just ask if you meet someone from our health department to thank them. We're all grateful for their dedication and commitment to our city. Staying on the tone of positive reinforcement, rather than giving a lecture about mask wearing, I thought it might make some sense to thank everyone who is doing their part to fight this virus by wearing masks. You're patriotic, you care about your community, you care about your health, you care about the health of people around you, and I appreciate that. We know that masks work in reducing the spread of this virus. If you are interacting with people outside of your household, be it at work, in the grocery store, or on the sidewalk, you should be wearing a mask. Wearing a mask around others is not only a way to protect your health, but the health of others around you. And I think that gets lost in all the dynamics, and I'm hoping the dynamic on this will change now that the election has passed us, that this will no longer be a political issue, and we can just focus on getting life back to order. Because again, as you're going to hear from our health experts, we are not back to order, and we don't even see the light at the end of the tunnel right now. So keep up your mask wearing, especially as the weather grows colder and we spend most of our time indoors. If you are in need of a mask, the Milwaukee Health Department lists its free mask sites at milwaukee.gov/masks. So take advantage of that as well. And with that, I'll turn it over to the County Executive. Mr. County Executive.
Thank you, Mayor Barrett. I want to start off by thanking Governor Evers for addressing the whole state of Wisconsin on Tuesday. His message was very sobering. We need to stay home. When we have to go out, we need to wear a mask. I saw a COVID-19 case map of the country yesterday, and all of the red concentration around the Midwest. Wisconsin is almost entirely red right now. And our Department of Health and Human Services Deputy Secretary said that Wisconsin is now seeing more cases per day on average than New York City did at the peak of its surge this past spring. Despite the sobering statistics, I also know that so many people are taking precaution. And so when I've been out all throughout Milwaukee County, I'm extremely pleased by the number of people I see wearing masks, for taking precautions and caring for one another. I want to say thank you, and let's continue to keep this up. Our safety and the safety of our loved ones really depend on this, so we have to do it. It's important to also continue taking these safety precautions seriously. Just a few hours ago, I signed the 2021 budget with Chairwoman Marcelia Nicholson. We did it outside, we were masked up and physically distanced, but it was the symbol of collaboration between our two amid a global pandemic. I'm proud of how the county board and my administration have worked together to close a $42.5 million budget gap and invest in our neighborhoods, transportation, parks, safety, and public health. We consider this budget in the context of the twin pandemics of racism and COVID-19. Our first priority at Milwaukee County is to make sure our essential services are going, from mental health to transportation to emergency response to housing. They have to continue working for the people who need it most, despite the challenges brought about from these two pandemics. And with this new budget, Milwaukee County has every reason to feel optimistic that we can recover from the current public health crisis, improve outcomes for county residents better than before. And with that said, we've largely avoided cuts to services this year because we were smart about the way we used our federal CARES dollars. For example, funds were not available for Milwaukee County for transit particularly. MCTS would have faced a budget gap of over $12.1 million for 2021. We were able to navigate around this with just the services or bus fares this year. We also use our federal funding to keep our essential services open and running for the public. We are investing upfront and retrofitting our buildings with plexiglass, improved HVAC systems, and protocols for physical distancing. We bought large amounts of PPE for our first responders, and we have partnered with the city of Milwaukee to expand COVID testing at Miller Park so that everyone who wants to get tested can. We've dedicated millions to eviction prevention and mortgage assistance, small business grants, and mental health. But these funds expire in just 7 weeks. And that is why this week I've joined Mayor Barrett and all mayors and village presidents within Milwaukee County in signing a letter requesting additional support from state leaders to assist local governments in their COVID-19 response efforts. These funds are extremely critical to our community's ability to address the public health and safety challenges caused by this pandemic. And as this pandemic stretches on, our local governments continue to struggle to find resources to support their response efforts. Local governments, health departments, and emergency management agencies in Milwaukee County have exhausted our resources this pandemic. And so I'm calling on state legislators to convene a special session to address COVID-19 and work with the government. Without additional assistance, we're able to conduct the basic mitigation and prevention efforts that is critical to addressing this pandemic. And we need state help, especially in developing and funding a plan that allows for these efforts to continue into 2021. And I encourage folks to reach out to their state assembly representatives and state senators and tell them our communities need their support. And so with that, I'd like to hand it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First, to our numbers, we've had 52,923 confirmed cases of COVID-19 in our community and 547 individuals who've died. This has been another tough week for Wisconsin and for Milwaukee County in particular. The state set a new record this week for new cases, for new hospitalizations, and sadly for new deaths. Earlier this week, Wisconsin saw 7,073 new cases in a single day on Tuesday. It saw 143 additional hospitalizations on Monday and 66 additional deaths on Tuesday. And we're seeing similar trends and similar record numbers in Milwaukee County, most concerningly with hospitalizations, as we saw a new record 55 additional hospitalizations in the county just over the weekend, the highest we've seen yet. As we set new records for cases, hospitalizations, and deaths week after week, we can see very clearly that our situation is worsening. And as we see this worsening situation in the state and much of the country, it leads to particular challenges around Thanksgiving. I wanted to focus for a bit today on college students and how to manage the Thanksgiving break. We see a variety of approaches from colleges and universities, some having more traditional Thanksgiving breaks and others having extended breaks or transitions to more virtual learning. Either way, it's likely that there will be a transition of students traveling back home. And it's in that transition that we can follow certain guidelines to be as safe as possible. In an ideal world, a college student would strictly quarantine for 2 weeks prior to interaction with their families. Of course, this is a challenge. Not only is quarantining on campus difficult, but cross-country travel leads to many safety concerns as well. Each university, each student, and each family will have to make their own decisions on how to be as safe as possible, but there are several principles that you can keep in mind. First and foremost, please don't take COVID lightly and don't underestimate your risk. Our trends in Wisconsin are frankly terrible, and the last thing that any student wants to do is unknowingly bring disease back to their family or their loved ones, who are not as young and are not as healthy as they are. You want to make sure that everyone who could sit around the Thanksgiving table dinner this year will be able to also sit around it next year. Second, with that in mind, you can quarantine as much as possible for 2 weeks before going home, and that starts today. You may need to go to class, but wear a mask and physically distance. But you can certainly take the next 2 weeks before returning back home to avoid social gatherings. Avoid interacting with those who you don't live with, avoid restaurants, avoid bars, and minimize trips outside of your living space. Third, when traveling, consider driving alone or with those with whom you already live. When you drive alone, you control your exposures much more than when you fly or take other public transportation. You can bring along food, you can minimize your stops, and you can really try to keep distance the entire time. And fourth, consider getting tested within a few days of going home. This may help catch cases in young people that are more likely to not have symptoms, but can still be contagious. However, as with any time you're tested without symptoms, it's so important to remember that a negative test is just a snapshot in time. It doesn't mean you don't have the virus or that you won't become contagious or symptomatic in the next few days. It doesn't negate the need to quarantine, but it is an added layer of protection. By considering each of these items, taking risks seriously, quarantining as much as possible for 2 weeks, driving if possible, and considering a test a few days before returning home, you can hopefully minimize the risk. I certainly wish we could have a normal Thanksgiving. I'd love to see and celebrate with my family in 2 weeks. I think everybody could use a normal holiday right about now. But the fact is that we're in a perilous time as a state and as a country. We saw our neighbors in Canada suffer a spike in cases unlike any they had seen before after their Thanksgiving earlier in October. We may not be able to avoid the same surge here, but at least we can try to minimize it. And remember that for each large gathering, there are many, many more small gatherings that lead to the spread of disease. We have 2 weeks starting today until Thanksgiving. If you haven't done it already, now is the time to buckle down, the time to quarantine, and to work to keep our loved ones safe. Thank you, and stay safe, and I will hand it off to Greenfield Health Director Roush.
Thank you, Dr. Weston. Good afternoon, everyone. I'm privileged to join today to talk through some of the key data in addition to what Dr. Weston has already shared. Before I start today, I'll start with a few overarching issues that we're seeing in the data. And when I walk through that later, I'll be sure to point that out. As Dr. Weston and others mentioned, we're continuing on a sharply increasing trajectory of disease over the past several weeks. And we continue to set some very dubious marks in terms of COVID-19 data, both in Milwaukee County and throughout the state. The city of Milwaukee is currently experiencing 7-day averages in cases that are nearly 2.5 times higher than our previous high in May of this year. And the suburban communities are experiencing 7-day averages in cases that are nearly 4 times what we experienced in mid-July. These increases are seen both across the kids and the entire adult population as well. Secondly, you've heard from Dr. Weston, we have several indicators that reflect the ongoing seriousness of the COVID-19 pandemic. We continue to see our hospitalization rates trend up in those over the age of 80 years old, and that trend began in early October. The deaths are also increasing, and we're noting a significant increase in the suburban communities and primarily in our older, more vulnerable populations. Lastly, we know that hospitalization data has been trending upward, which significantly impacts healthcare capacity. And as Dr. Weston mentioned about Thanksgiving and thinking about gatherings, we need to make sure that residents are continuing to be vigilant in reducing their exposure to COVID-19 where they live, work, and play. This compliance is achieved through the 3 W's, wearing a mask, watching your distance, and washing your hands. But we also need to add consideration of gatherings and consideration with how we're interacting with others throughout the community. As Dr. Weston mentioned, the Thanksgiving holiday is upon us in 2 weeks, and we need to carefully consider how we can be safe during the Thanksgiving holiday. Recently, a study was published in the journal Nature that created a risk assessment planning tool. And in this study, they measured the estimated likelihood that a COVID positive person would be present at an event in a particular county. And when we talk about, in this case, an event, we're talking about a house party, a dinner party at a bar or restaurant, Thanksgiving at grandma's. And for Milwaukee County, they provided estimated likelihood that somebody would be attending a gathering depending on the event size. And as expected, the larger the event, the more probability that somebody is going to be there with COVID-19. For an event with just 10 people, there's a 49% chance that somebody will be there who may be COVID positive. And that increases. An event size of 15 has a 63% chance of having somebody COVID positive in attendance. And an event size of 25, there is an 81% chance that someone could be in attendance that's COVID positive. So we need to continue to keep in mind how we interact in the community, and that has considerable impact on our Thanksgiving plans. And while these data are projections based on the potential likelihood of COVID in the community, we know our rates continue to go up. And I think these data will help us understand, and should help us understand, the risk of COVID in our community and help us understand the risk of disease, even within small gatherings that are family or extended family. So with that, let's move into the data, and I will share some of the current trends that we're seeing in our data this week. And Catherine, you might have to give me access, it looks like. All
Give
right.
me 1 minute. You should be able to share now.
All right, it is not working on my end. So why don't we just plan to send the report out, Catherine, or excuse me, Sydney, and we'll just go to the Q&A.
I can try to share it from mine. Hang on.
Very good. Thanks, Catherine. If you want to scroll down to the first table here. So this table reflects the increases that we've been seeing really since the early part of September. We continue to climb up, and this is where I noted earlier that the city of Milwaukee is averaging almost 500 cases a day as their 7-day average, and suburban communities are averaging nearly 400 cases per day. If you continue down, Catherine, we'll look at the deaths in the next chart. And as I noted last week, we're seeing an increase and a spike there in deaths, particularly in the suburban communities. And that's something we're going to watch very, very carefully. The data seem to indicate that hospitalizations and deaths are increasing in our older, more vulnerable populations. And certainly we have some concerns with case activity in long-term care, as much as we saw this spring. All right, if you continue to scroll down and keep going to the transmission rate, reproductive number right there. Thank you. A disturbing trend that we continue to see this vacillating transmission rate or reproductive number for Milwaukee County. Largely, we've been above 1.0 since early September. We've gone up, we've gone down, and the trends in the suburban communities are certainly a little bit more disturbing than we're seeing in the city of Milwaukee. But largely the reason we're seeing the increases we have since September 1st is that this transmission rate is above 1, which means that for every one person with COVID-19, they are infecting 1 or more individuals on average. Continue down, Sydney, please. You can keep going. We're seeing the same demographic patterns as we've seen. You continue to see increasing cases in the white population very, very significantly. We're continuing to see most of our cases in the 25 to 39-year-old age group, as well as the 40 to 59-year-old age group, and those trends are pretty steep. We can scroll down now to hospitalizations, which is in the second page. here, I just want to note a very, very disturbing increasing trend in the blue line and the purple line as it relates to age. So the blue line is the 60 through 79 age group, and the purple line is the 80-plus-year-old age group. While the numbers are higher in the 60, 79-year-olds, we know that 80-year-olds and older are being hospitalized at a rate of 4 times higher than any other population subgroups. So we want to really be watching that community going forward. Continue on, Sydney. Down another page, deaths. And again, we continue to see deaths in our older populations, and it does look like there's been an increasing spike in the purple line, which again is reflected as 80 plus on this graph. And if you go down to testing, Sydney, should be 2 pages. Testing is always a bit lagging in the most recent week, but we have seen a marked increase in testing. And as we have mentioned in the last several weeks, testing is very hot, and a lot of our sites are running out of testing capacity. So if you're interested in getting tested, make sure you find a site and get there early, because a lot of the sites are closing down early. We're seeing sharply increasing trends in positive tests, and seeing very disturbing trends in percent positive tests that are approaching 20 to 25%, which is a direction that we don't want to be heading. Continue down, Sydney, to the graphs. The next one reflects the current week. This is where new cases of COVID have been seen throughout the community, and red indicates that we're seeing more cases in those areas. So we have a lot of areas throughout the county that are red, that are indicating high disease activity. And then notably, we have some areas in blue where it looks like people either are not having testing or are not accessing testing. And so that's also equally concerning to us. Go down 2 more maps, Sydney, please. This looks at where people are getting tested within the last week. And again, we're seeing testing availability throughout the county, but certain parts of the population, as Dr. Weston and others have mentioned, are maybe not accessing that testing as much. That's the end of the data report for today, and I'll turn it back over to Sydney and we can go into the Q&A. Thanks for your help, Sydney.
You bet. Our first question comes from Hillary Mintz at WISN. Mayor Barrett, you previously mentioned $500 fines for bars and restaurants not complying with health and safety orders might be too low. Do you think the proposed $5,000 fine will send a stronger message?
Well, it certainly does send a stronger message, and I do support raising the fines. I'll be working with the Common Council and the Health Department to see whether that's the final figure that we agree upon. But there's no question that we have to raise the fine. We've heard reports of operators or venue operators who have said, well, I've got a $5,000, $6,000 event coming up and the fine's $500. I'll just tack that onto the cost. That's not what we're trying to do. We're trying to stop the spread of COVID-19. And whether you're a bartender who doesn't wear a mask, whether you're a patron who doesn't abide by the directive that you remain seated and that you keep a mask on unless you're eating or drinking, listening to Dr. Weston and listening to Darren Rausch, it's clear that we have to take more dramatic steps. And short of closing these operations down, I think that raising the fine is an effective way of dealing with it. We'll see if it works. Again, right now I'm not focusing on the final number as to what it will be, but I do support raising the fines.
Our next question comes from Sari Lusk. If the Common Council approves the higher fines for COVID-19 violations, how would the city determine the amount between $500 and $5,000 to charge someone?
Again, that's one of the issues that we're ironing out right now to see whether it should be the same no matter what the infraction is. But that's part of the conversation that's going on right now.
Our next question is from Mary Jo Ola at TMJ4 for Dr. Weston or Darren Rausch. Regarding the surge of cases now, where are they coming from? Is there one thing you can point to?
Yeah, that's a very good question. We continue to do a lot of disease investigation and try to track where these cases originated from. And as has been the story for the last several weeks, a lot of it's tied to gatherings and tied to exposures in and around the community. This morning, I had the opportunity to talk to several schools in the greater Greenfield area, and many had indicated to us that students and families reported going to a Halloween party, and that was where the exposure was. So consistent with what we've seen with past gatherings, whether it was Easter, 4th of July, Labor Day, I think Halloween and the upcoming Thanksgiving and Christmas religious holidays are going to be occasions where disease is going to continue to spread.
Yeah, I would agree. I think that we're certainly seeing rises in all our age groups, as Director Rausch mentioned. There's been national studies and global studies that have shown that the hotspots seem to be places where people gather, which isn't surprising. So we think of restaurants, we think of bars, we think of gyms as spots where a lot of spread is happening. And then I think it's important to remember that it is not just about large groups, it's about small groups as well. For every large wedding that occurs, for every large banquet that occurs, there's hundreds of small gatherings where you just have your neighbors over, you just have your in-laws over, you just have your parents over. Those sort of things. That's how a lot of the spread occurs on these small scale levels that add up and up and up to many, many cases.
Our next question comes from Allison Durr at the Milwaukee Journal-Sentinel for Dr. Weston. How are Milwaukee hospitals doing in terms of staff? Are they seeing outbreaks among staff, and what does that mean for their ability to provide care?
So Milwaukee hospitals, much like hospitals in the state, much like businesses throughout the state, are seeing their staff suffer under COVID. And it creates shortages, especially when you're talking about hospitals and you're talking about essential staff that can't work from home, can't take sick time and have their jobs continue functioning as effectively as they were before. So certainly our hospital systems are struggling. They're seeing people needing to isolate, people needing to quarantine on all different levels, doctors, nurses, administrative staff. So it is creating a lot of challenges.
An additional question from Allison Durr. Assuming cases will rise substantially after Thanksgiving, just the beginning of the holiday season, is there any way for the healthcare system to ramp up now in preparation, or are the hospitals stretched so thin that their ability to prepare for any increase is limited?
I mean, to be frank, I think our hospitals are being pushed close to limits right now. A lot of planning went into place back in the spring. We have a phased approach to use all the clinical space first, then start to use non-clinical space. We have a care facility. Milwaukee County, the hospitals, the health systems did a great job preparing for that. But really no hospital, no health system can keep up with a continually accelerating curve. It's not even just stable increases. It's getting worse and worse. Every week we're setting new records. Our region of the state has large health systems and large hospitals. That helps us to take a little more of the burden. But certainly we see in other regions of the state where there's single digit ICU beds available in the entire region of the state. That's not where we want to get with Milwaukee County and with the southeast region of the state. So I think over Thanksgiving, it's probably going to get worse. I think there's no getting around that, but hopefully we can minimize how much worse it's going to get.
Our next question comes from Hannah Hilliard at WISN, also for Dr. Weston. Are the individual plastic domes we see popping up at bars and restaurants a safe way to dine outside during the winter months? Are they safer than large tents that seat multiple groups?
So I think a lot of this depends on how the airflow is working within those tents. So if you can have a small tent that's just you and people within your household, and there's good aeration so that the people who were with you before, all the droplets and aerosols that they've been breathing aren't still in there, potentially that could be safe. But I think we have to think about what the governor said just recently, that really what people need to be doing now is staying home. We need to minimize any non-essential activities, whether that is, unfortunately, going out to restaurants, whether it's going over to friends, whether it's getting together with family who you don't live with. We're facing a mounting crisis in Wisconsin and in Milwaukee County, and this is the time to really buckle down.
Our next question comes from Christina Van Zelst at Fox 6 News. A release regarding the importance of contact tracing was sent out by the Milwaukee Health Department yesterday. How important is this ahead of the holiday and as cases continue to increase? What else can people do to help with contact tracing?
Well, I'll jump in here on this. I think one of the things that we're seeing is with the dramatic increase in cases, it is difficult for all health departments throughout the state of Wisconsin to keep up with the tracing. And so we are asking individuals who have tested positive to take those steps themselves and to reach out to those individuals that they have been in contact with so that they know that they have been exposed to the COVID-19. Our number one priority as a health department right now is getting back to the individuals who have tested positive. That's first and foremost what we want to do. And then it's our expectation that they will share that news with those they've been in contact with.
Our next question comes from Allison Durr at the Milwaukee Journal-Sentinel. Also for Mayor Barrett, if the Common Council passes the new ordinance, do you anticipate signing that ordinance?
I anticipate at the end of the day, we will have an ordinance that I will sign. Whether it's exactly this one, I think it's too early in the process to say. Again, we're looking at it right now to see whether there should be different gradations. We're looking at it to see whether we should build into the ordinance itself a different type of metering. But that's all, it's a work in transition. But again, to be clear, I support raising the fines. I think that we have to send the message because the next step, other than raising fines, is to close establishments. And so I think for those individuals and those businesses that are not following the rules right now, they may make it worse for themselves, but they may make it worse for everybody else. So we are looking for compliance is what we are looking for.
Thank you, Mayor Barrett. Our next question comes from Sari Lusk at the Milwaukee Business Journal. We've seen a lot of messaging around personal choices and gatherings and not regulations to that effect. What else can and might municipalities do besides encourage people not to gather? Why not implement rules around that?
I think that's a good question. I think in a lot of cases, what happens is that the rules that we've been making have been very difficult to enforce. In Greenfield, for example, the health department is a very small staff. So passing orders on or ordinances about what people can do are very hard to enforce. And we've seen in other parts of the state that these are challenged and litigated. And certainly one of the things that we continue to appeal to is our residents' personal choices and making choices that align with their own personal safety and that of others in the community.
Thank you, Commissioner Rausch. Our next question comes from Graham Kilmer at Urban Milwaukee for Dr. Weston. Would increased demand for COVID-19 convalescent plasma treatment indicate that the number of severely ill COVID patients is rising?
Yeah, so we've certainly seen an evolution in the treatment of COVID patients over several months. The treatments that you see now for mildly ill as well as critically ill COVID patients is very different today than it was back in March or April. And part of that is the convalescent plasma. So I think part of it is availability. Part of it is an understanding that that's an important treatment in certain patients. And so I think it's hard to necessarily tie those two together. However, when we see increasing hospitalization numbers, we know that a certain portion of those patients that are hospitalized are critically ill. When we see shortages of ICU beds throughout the state and in many parts of the country, we know that those patients are critically ill. So certainly, I think regardless of any drug demand levels, we know there's a lot of people sick with COVID and there's a lot of people critically ill with COVID.
It looks like we're coming up on one of our final questions from Brittany Lewis at CBS 58 for Mayor Barrett. At what point would the city consider putting in another safer at home order like we had earlier this year?
Well, one of the things that the county executive mentioned in his initial remarks was his desire, which I concur with, that the state of Wisconsin provides some unified leadership here. And obviously, Governor Evers has attempted to lead this effort, but has been thwarted time and time again by the legislature and by the courts. What that means to me is it means that we need the legislature to partner with the governor, that we should have a special session of the Wisconsin State Legislature to decide what steps are needed in areas like mask wearing, like stay-at-home orders, because what has happened over the last 7 months is that the legislature, the Republicans in the legislature, have decided that the best course of action is to do absolutely nothing. We now know that doing absolutely nothing has been a total disaster. It has been a failure. More people are getting sick. More people are being hospitalized. More people are dying. So the first and foremost, what I would like to see is I would like to see the state of Wisconsin, through our elected leaders at the state level, work with our governor and come up with a plan for the state of Wisconsin. Will we consider further orders if necessary here? Absolutely, yes. Do I have a timetable for that? I do not have a timetable for that. But I don't think it's fair to residents. I don't think it's fair to employees. I don't think it's fair to businesses to balkanize this state and have every municipality in Milwaukee County or southeastern Wisconsin have a different set of rules. It creates uncertainty. It creates distrust. It creates problems in enforcement. And I think that the best course of action is to finally, as a state, say we are in this together and we are going to act together. That's what I want to see right now.
Our next question comes from Sari Lesk. We've heard an emphasis on seeking compliance from Milwaukee businesses, but the Deputy Health Commissioner, Claire Evers, said this morning teams checking for compliance didn't find any violations last weekend. How will the city find non-compliant businesses? What needs to change?
Well, I actually think it's pretty good news that they didn't find non-compliant businesses, because I've had 2 calls with the health department already today, and this was one of the issues that came up. What we are seeing, and again, I'd like to lead with positive reinforcement, is we are seeing most individuals and most businesses complying with the rules. What we are also seeing, though, is we're seeing a limited number of businesses and individuals who are not complying with the rules. And again, you can have one spoiled apple can spoil the whole bushel. We don't want to see that happen in Milwaukee. So what we are doing is that we're having teams that go out. First, they look at the complaints they've received during the week. Then they'll visit those places. Then they'll go to other places on their own. I think this weekend we'll have 3 teams that are out doing this. And if we need to expand that, we will ultimately expand that as well.
That appears to be our final question from the media for today. Thanks for joining us, everyone. We'll be back here next Tuesday.
Thank you.